Hi, this is Elliot from Nutrition, and in today's video we are going to be examining the clinical features of a thiamine or vitamin B1 deficiency. So we'll be looking at what this actually looks like in real life, what kind of symptoms and presentations someone might have if they do have this problem, and then we'll be examining some of the causes, the reasons why someone can develop this deficit. We'll also be examining whether a ketogenic diet or a carnivorous diet is sufficient to effectively resolve this or address this deficiency. And then we'll be looking at some case studies that I've seen very recently of people who've got in contact with me who had been on a ketogenic or carnivorous kind of diet and had not actually seen the benefits they wanted to. It was only when we added in supplementation that they got enormous health changes. So the main signs that we are looking for are chronic symptoms, severe symptoms which are related to three bodily systems. First of all, we are looking at the central and peripheral nervous system. So someone can be getting all kinds of symptoms related to this or stemming from this system. This is dizziness, it can be poor body temperature regulation, neuropathy or pain or tingling in the peripheral nerves. We can have brain fog and anxiety, poor circulation. There can be central fatigue or systemic fatigue, which again can stem from a problem with the nervous system, but also if we're looking at thiamine's role in every cell in the body, it's needed to make energy. So we end up with a systemic energy deficit throughout all of the cells. But there's many other kinds of neurological symptoms, including one of the primary forms of dysautonomia is postural orthostatic tachycardia syndrome. Many people develop visual disturbances and other symptoms related to this. We can have problems with the cardiovascular system as well. One of those being tachycardia, so rapid heart rate or rapid pulse rate. And then someone may also have an unexplained low blood pressure. This is something I see very frequently, or it can be erratic or unsteady blood pressure. Also, unexpectedly, the symptoms can manifest in the gut. So we have to remember that the gut is innervated by the enteric nervous system, and that is partially controlling our digestive secretions, our stomach acid synthesis, the gastric emptying, the different sphincters, so the pyloric, the esophageal sphincters, how well we are able to induce motility, so propel food throughout the intestine. And so it's unsurprising that actually some of the symptoms can be gastroesophageal reflux disorder. We can have chronic bloating, so someone may have delayed gastric emptying. They can feel like there's a rock sat in their stomach. They may have constipation due to a lack of motility. They may also have chronic gut pain, visceral hypersensitivity as it's referred to. Something that I see fairly frequently is undigested food in the stools and the symptoms of low stomach acid. So people are unable to effectively break down food, and because of a lack of pancreatic enzymes, because of a lack of stomach acid, which can be caused by this enteric nervous system energy deficit. Now, the real pioneer of thiamine therapy, or the clinical application of thiamine, was Dr. Derek Lonsdale, at least in the Western world. So based on the research done on thiamine in Japan, Dr. Derek Lonsdale also did extensive research on this nutrient himself, and he was working with children, a pediatrician at the Cleveland Clinic, and he found it to have immense benefits for various types of health conditions relating to the nervous system, including dysautonomias of many different kinds, autism, ADHD, other kinds of behavioral neuropsychiatric disorders, but also things which mimic kind of chronic fatigue syndrome, post-viral fatigue syndrome, and fibromyalgia. Now, if we look at the basic functions of thiamine, essentially what you need to really know is that the more glucose we need to process, the more thiamine we need, because thiamine is absolutely critical, a very important part of glucose metabolism as a cofactor for an enzyme called pyruvate dehydrogenase. It's also a cofactor in a process called the Krebs cycle, which is the next stage of how we are deriving energy from various food components. Now, thiamine is not only really necessary for the metabolism of glucose for energy, but also for the metabolism of fats and proteins for energy as well. Now, some of the other main functions, and this list is by no means exhaustive, but thiamine is a cofactor for several other enzymes. So not only are we breaking down glucose for energy, we can also use glucose in anabolic reactions to build things up. And this is through something called the pentose phosphate pathway. In this pathway, we are using this to regenerate the antioxidants glutathione. And so it's particularly important for the antioxidant system and protecting against oxidative stress. It's also how we're synthesizing macromolecules such as the fatty acids needed to make myelin sheath. Furthermore, thiamine is central in how we are breaking down certain amino acids coming from particularly red meat sources, but any other protein source which contains leucine, valine, and isoleucine. So how we are breaking these down relies on an enzyme which is a thiamine-dependent enzyme. Likewise, how we are taking certain odd-chain fats and running them through a separate phase of breakdown called alpha oxidation is also a fairly new established function of thiamine. Now, aside from its role in processing macronutrients, it's also central in the nervous system. In fact, a thiamine deficiency primarily affects the nervous system, or affects the nervous system first of all. Now, it's needed to synthesize the neurotransmitter acetylcholine and also glutamate, and then the inhibitory neurotransmitter GABA. Furthermore, neurons utilize thiamine in how well they are able to regulate the various ions across the plasma membrane, and then we are using it to maintain and build myelin sheath. And actually, one of the forms of thiamine is necessary, seems to be necessary, for how we are conducting nerve signals, transferring information from one neuron to another neuron. Now, there's certain areas of the brain which are particularly sensitive to thiamine deficiency, and this is because they have a very high rate of oxygen utilization, of energy metabolism. They need lots of energy, and these are the lower portions of the brain referred to as the brain stem, the mammillary body, the hypothalamus, the thalamus, and the cerebellum. Now, interestingly, these are the areas which are primarily in control of the autonomic nervous system. Now, the autonomic nervous system, for those of you who don't know, this is divided up into two main branches. One is called the sympathetic and the other one is called the parasympathetic. And what this is essentially doing is allowing us to adapt to environmental changes and environmental stimuli via controlling those involuntary processes that we don't need to think about. That means our body temperature, our digestion, our heart rate, the constriction and dilation of our blood vessels, etc., etc. And so when we are thiamine deficient, these areas of the brain and this autonomic nervous system is one of the first things to be affected. And we can end up with dysfunctional or with a dysfunction in these areas of the brain, which ends up causing a dysfunction in the entirety of the autonomic nervous system. The body loses the ability to start to be able to adapt to those environmental changes, and we can have all kinds of misfiring and whatnot. So Lonsdale really characterized this concept of high-calorie malnutrition. So for those of you who aren't familiar with this, essentially in foods we have two major classifications of nutrients. We have macronutrients, which is in the forms of protein, fat, carbohydrate, and these are the things that we get a lot of in the diet. We need a lot of them to stay healthy. On the other hand, we have micronutrients. So these are found in much smaller amounts and required by the body in much smaller amounts. These are basically made up of the vitamins, the minerals, and the other nutrient cofactors, things like coenzyme Q10, alpha lipoic acid, etc. And basically what you need to know is that to process the macronutrients, to use them to build things up, to build muscle, to burn for energy, we need enough micronutrients. And the problem is that in our modern world, especially in the Western world, we process our food. So when someone consumes higher levels of processed foods, because we take away or we destroy those micronutrients, then actually what can happen is as we consume too many of these refined processed macronutrients, we can actually run up a deficit or deplete ourselves of the micronutrients needed to process them. So I am certain that thiamine deficiency is a deficiency of epic proportions, at least in the Western world, simply because we have had a long period of time of consuming, or the majority of people having access to excessive intakes of glucose, starch, refined sugar. And the problem with this is that this increases our requirement for thiamine. Now, when someone consumes these foods for a long period of time, it can very easily deplete us of thiamine. If you recall me saying that thiamine is really, really necessary for how we are taking sugar, carbohydrate, and burning that for energy. In fact, someone who is on a high carbohydrate, high sugar diet is going to have much higher requirements for thiamine than someone who is on a low carb or ketogenic diet. So just coming back to some of these symptoms, based on this concept that I've just spoken about of the autonomic nervous system dysfunction, well, we see that the autonomic nervous system is in control of things like the blood pressure, is in control of gut motility, is in control of body temperature, is in control of the constriction and dilation of blood vessels. And those parts of the brain are also involved in our appetite and our nutrient partitioning. So actually we see that many of these symptoms can be linked directly back to the problem with the autonomic nervous system. Now, some primary risks or triggers, the most well established is heavy alcohol use or a history of alcohol use. So if someone comes to me and they say that they have these kinds of symptoms and they have a history of long-term alcohol abuse, then the first thing that I will look at is thiamine. But not only alcohol destroys thiamine, coffee also contains certain tannins which can deactivate thiamine in the gut. So 1 or 2 cups is not a problem, but when someone is having 4, 5 cups all throughout the day, then that is potentially going to be a big problem for someone's thiamine status. As I've already said previously, the high sugar, white rice, or refined carbohydrates, generally if someone is eating these for a long period of time before they get sick or before they become ill, what I refer to as the crash, then actually thiamine is potentially going to be involved here. And it's definitely something that I will be looking for. Chronic digestive issues, and this is something which many people experience for long periods of time. It can be any form of IBS, especially IBS diarrhea, as we know that the B vitamins, B1 included, is water soluble. So it's really quite easy to run up a deficit if we are having kind of chronic diarrhea and we are losing a lot of that through the stool. Something that I also see very frequently is people who develop a thiamine deficiency, quite severe one, generally tend to be doers. They tend to have quite high activity in their life. So it can be, they might be into athletics. They might have a very stressful workload in their job. They could have some kind of chronic stress, some kind of family breakup or trauma. And this usually leads up, or this is one of the antecedents to really creating the conditions in the body where this person is susceptible to a deficiency disease, simply because when we are athletic or when we are going through any kind of physical stressor, physiological stressor, we are ramping up metabolism, and generally we increase the requirements for nutrients when we do that. There are certain pharmaceutical medications also well known to induce a deficit of this nutrient. One is loop diuretics. These cause thiamine wasting through the kidneys. And then there is also a certain type of antibiotic referred to as metronidazole. Another risk factor is surgery. If someone has gastric surgery, or if they have some kind of an acute viral or bacterial infection, this sometimes seems to be a trigger and can induce a deficiency in certain people. Now, generally, after someone crashes, say they'll go for the first 25 years of their life, they feel as though they're healthy, and then all of a sudden there will be a triggering event. And that triggering event generally tips them over the edge, and that's when they develop many of their symptoms. Now, after this so-called triggering event or crash, these people generally tend to find that they are intolerant to carbohydrates. They can't tolerate them. It makes them feel fatigued, might make their symptoms worse, might induce panic attacks or anxiety attacks. They're also very intolerant to alcohol, and I think this reflects the low level of thiamine that they have in their body. When they consume things which deplete that further, it naturally induces a negative reaction. These people might describe their nervous system feeling as though it collapsed or feeling as though it's on fire. These people are often very chronically fatigued most of the time. And what I often see is there's a negative response to B vitamin supplementation, like multi-B vitamins or other types of B vitamins, folate and methyl B12. Sometimes they also have a negative response to magnesium supplements as well. Now, what these people generally find is that they see a mild improvement or a moderate improvement when they go on a carnivore or ketogenic diet, only about 50%. Remember that when we eat more carbohydrates, we use more thiamine. So when someone goes on a very low carbohydrate diet, they naturally reduce the requirements for thiamine. However, a ketogenic or carnivorous diet, I'm not convinced that it can actually resolve the thiamine deficit, and there's various reasons for that. In fact, I'm not convinced that any diet can do that if it's severe enough. So these people generally tend to find some improvement, but they don't get better. Now, the symptoms, as I've said, will primarily manifest as three different systems. This is the neurological, cardiovascular, and digestive systems. However, some people may display symptoms in all three of those systems, but some can only display symptoms in one or two of those systems. So it may be mostly digestive and some neurological. It may be non-digestive symptoms, but actually they're getting neurological and cardiovascular issues. So it needs to be discerned in the right way, and that is what a kind of consultation is for, really. But these people generally find that if they can get to sleep, many people have insomnia, but actually if they can get to sleep and they don't have a problem getting to sleep, they often don't feel rested when they wake up. Now, it's important to note that in opposition to the conventional medical way of viewing a disease, I like to look at it as a spectrum. So a conventional medical physician would likely class someone as falling within the box of health and then falling within the box of disease. And those two are two different things. Well, whilst I agree there is often a large gray area in between, and there's a spectrum. So someone can be moderately healthy but still have a moderate insufficiency or a severe insufficiency. They may gradually go on to develop quite a deficit in thiamine or any other nutrient, but they do not fit the clinical characteristics or the diagnostic criteria to receive a full-blown diagnosis of a disease. So they may have 70% of the symptoms or 80% of the symptoms even, but because they don't fit the diagnostic criteria, they don't get a diagnosis from the doctor, and often the condition goes overlooked for long periods of time. Now, we were talking previously about this trigger or the crash. What I often see is that, as I've laid out on this timeline, it's usually the straw that broke the camel's back. So on the left-hand side, you can see that someone can go maybe 10, 15, 20 years, 30 years even, being chronically insufficient. So they may have one or two symptoms, they may have a couple symptoms, but they feel relatively healthy. But with chronic stress, with other kind of influences, what will happen is these antecedents will lead up to this triggering event, and the trigger can be any kind of event. It can be a bacterial infection, it can be the loss of a loved one, it can be a car accident, it can be a surgery, it may be any kind of acute event which basically is the straw that broke the camel's back. It sends someone over the edge. Now, what we see then is that their metabolism really changes. It's almost like there's a complete metabolic shift, and these people all of a sudden may develop symptoms which they've never had before, and in many different systems of the body, which randomly came out of nowhere. And in the literature, it shows that actually people who are deficient in certain nutrients, particularly in thiamine, then the enzymes which are used, which use that nutrient, are actually downregulated. So we get this enzymatic downregulation inside the cells. And I think that this has to do with all of these symptoms coming on at once, is really a reflection of that. So if we look at the full-blown deficiency disease of thiamine deficiency, there's two primary ones. There's beriberi, and there's multiple forms of that. So there's neurological beriberi, there's cardiovascular beriberi, and there's GI beriberi. There's also kind of an offshoot of that, and that's Wernicke's encephalopathy, which affects the brain, and Korsakoff psychosis or Korsakoff syndrome. Now, it's well established that even if these patients with this kind of full-blown deficiency disease, even if they adopt a very healthy diet, which is high in thiamine, even if they get rid of the alcohol or remove the things which were depleting them of thiamine, simply diet alone is not sufficient to resolve this problem. In fact, it's well established that you need at least 100 to 1,000 times the recommended daily intake, and this can be for anywhere between 6 to 12 months sometimes to actually achieve like a full-blown remission from the disease. And so it would be amazing if someone who had this problem could address it purely from diet alone. But I am not convinced that they can. I think some people, if they have a moderate issue, then they can do fine with adopting a ketogenic or a carnivorous kind of diet, or a very nutrient-dense diet, whatever that may be. But if someone has a severe enough deficiency, I honestly believe that they need to address that with much higher doses of the nutrient to really kickstart processes working back again. Now remember that the RDA for thiamine is only about 1 to 1.5 milligrams. So these people require very high doses to see the benefits that they would like to see. Now we're going to look at some case studies of people who've come to me very recently and really display thiamine deficiency. We're going to look at the medical history, the symptoms that they displayed, why I thought what I did, and how they responded to therapy. So the first case one, is a male in his mid-20s. So he had a medical history of quite severe neuropathy, severe constipation, like very severe constipation. He was going for a bowel movement once every 2 to 3 weeks, most of the time. It'd been like this for a long time as well. He had had GERD, upper GI symptoms, so reflux, and constant bloating. No matter what kind of diet he tried, constant bloating. He was also severely underweight. Now, he had been severely underweight for anywhere between kind of 7 and 8 years. And when I say underweight, he's 6 foot tall and he was weighing about 53 kilograms. So that is really quite underweight, and his inability to gain weight either. This is the thing. So he tried eating more food. He tried doing all of these different things, unable to gain any more weight. He also had a history of autoimmunity, and other symptoms that he'd had previously had been extreme fatigue, dizziness, breathlessness, and unexplained low blood pressure. Now, to go a little bit more in depth into his history, he'd had a very high and long consumption of white rice. This individual's from Southeast Asia, so he'd been consuming white rice as a staple in his diet for a very long time. And around 10 years ago, there's a bit of a trigger. He'd been hospitalized and he was presenting with most of the symptoms of beriberi. Unfortunately, the doctors didn't pick it up, and his health was never the same since that point. So he tried multiple different diets. He'd actually been on a strict PKD version of the carnivore diet for around 6 months before coming to see me. So this kind of diet, it helped in some respects. It helped his autoimmunity, but actually most of the other symptoms were still present. So he saw my videos and he got in contact because of that. Now, what did we do? Well, looking at his symptoms, those upper GI symptoms, inability to gain weight, history of neuropathy, and various other things that we went through in a consultation, I was almost certain that this individual had a thiamine deficiency that was not addressed by diet. So actually what we did was we put him on TTFD, which is a certain form of bioavailable thiamine. We worked up to 150 milligrams per day, which is at least 100 to 150 times the RDA. We got him on a high dose B complex. He was already taking vitamin C and some magnesium malate. Magnesium is a cofactor for the same enzymes that thiamine is used in. So what did we see? Well, at 8 weeks follow-up, I was quite amazed. This was a really, really good result. So after 1 day of taking the thiamine, remember he had been going for a bowel movement every 2 to 3 weeks. Well, after the first day of taking thiamine, he was having daily bowel movements, and it has been the same way ever since. Likewise, his GERD, so his reflux, his upper GI bloating and indigestion almost disappeared within a couple of weeks. He'd gained 8 kg for the first time in the best part of 10 years, which he was really happy about because that was actually the main thing that he'd come to see me for. And he's currently enjoying working out. So he's able to work out. He's building muscle rapidly. He's actually able to eat more food. His appetite is regained. His fatigue has improved greatly because he was having daytime sleepiness. He's actually waking up feeling like he's got some energy. So overall, at 8 weeks, we've had an immense symptomatic improvement, very short period of time, simply by adding in thiamine with the thiamine cofactors, because this individual was severely deficient and he was not getting it from his diet. Next is another male in his mid-20s. So this individual came to me with slightly different symptoms. He had severe fatigue, but many of his symptoms were he felt in his brain. So mental sluggishness and a strange form of depression, which felt, the way that he described it, was feeling dissociated from his body, almost like his mind was separate from his body at certain times. He'd had a history of being chronically cold and having poor circulation. Another one of the kind of characteristic symptoms here was the chronic burping, constant bloating, and very poor gastric motility, like explaining that he felt sometimes that there was like a rock sitting in his stomach. And he'd also had this very strong tendency toward constipation, but then this would occasionally kind of shift to having loose stools depending on what he ate, the composition of fats and proteins that he was eating. He'd also had a terrible recovery from exercise. So he wanted to really deal with how he was feeling mentally and emotionally, how his digestion, upper GI was working, and how he could recover from exercise. Now, it's interesting to note that around the time that he crashed, he'd also been getting neuropathy, palpitations, and twitching. Again, these are, he's fitting the criteria of the cardiovascular, the neurological, and the GI symptoms. Now, digging more into his medical history just gives us more information. So again, this individual, when he went to university, he wanted to become a bodybuilder. He wanted to put on weight. And so he ate a lot of white rice, a lot of kind of refined carbohydrates. He'd been having protein shakes and things. And then he'd also been binging on alcohol, much like many university students do. So there was this kind of trigger. And after that, he lost tolerance to carbohydrates. He could no longer tolerate coffee, and he definitely couldn't tolerate alcohol. So this individual had been doing multiple variations of the carnivore or the ketogenic diet for around 18 months before coming to see me. Now, we had seen some improvement, but he still wasn't where he wanted to be. We did some lab work, we did some bloods. That all came up pretty much unremarkable. We did an organic acids, and it's interesting to note here that he had already been taking B1 for a couple of weeks before I sent him off for an organic acids. But what we did still see was some markers related to thiamine deficiency there. We saw there was an elevation in lactic acid, only slight, and we also saw that there was an elevation in one of the markers related to branched chain amino acid metabolism. This is called 2-hydroxyisovaleric acid. So on the next page here, you can see these markers, they were elevated. So even though he was taking thiamine, he was still demonstrating that he definitely had, or what indicated, a thiamine deficit going on. So with this individual, I told him to work up to 500 milligrams of TTFD with magnesium malate gradually. What he found was that as he was working this up, he worsened at week 1, so he actually got more fatigued. And then he felt better, and then he got worse again as he was upping the dose, and he got better. And this is how it goes. You have to kind of titrate it up and down, up and down. Generally, someone tends to get worse before they get better many times, and this kind of fluctuates. But what he did notice was that the bloating, the burping, and the constipation improved massively since he started the thiamine. I think he said that, a 1 month follow-up, he said that he'd had no constipation since our last consultation. He'd go through temporary periods of feeling euphoric, feeling like he had better concentration and energy. Also, as though his body could actually produce heat. He described it like a furnace. Now, it's important to note that this individual, it's still early days, and there's not 100% improvement on all different symptoms, but we are still kind of at the start of this, and sometimes it can take, 6 months to 8 months to really get to where you want to be. But overall, I'm certain that this individual is definitely on the right track. Next up, we have actually another male in his early 20s. I get quite a lot of these recently. And this individual, characteristic textbook example of dysautonomia and thiamine deficiency and all of those associated symptoms. So this individual, the trigger for him really was, or the thing which I think predisposed him towards this, was that he had early stress when he was around 10 years old, and one of his coping mechanisms was binge eating on sugar. Now, he'd done this for a short period of time, and then this led to kind of a little bit of a crash where he developed a very severe bout of constipation. Now, after that, his digestion never really normalized, and gradually he developed many of these symptoms which are related to this dysautonomia. So he developed a burning mouth, burning feet, and neuropathy. He developed severe small intestinal bacterial overgrowth, reflux disorder, bloating, and real bad slow motility. So again, similar to the other two, very slow motility, and he had actually been diagnosed SIBO. He'd done lots of kind of SIBO protocols, nothing had actually addressed it. He'd also had a condition referred to as laryngopharyngeal reflux, which I think is also related to this dysautonomia. Aside from this, he'd had severe fatigue, almost zero libido, which is something that he really wanted to address. Understandably, as a male in his early 20s, and he'd also had real bad problems adapting to different temperatures. So he'd be really cold, but then he couldn't go into a hot shower because that would actually send him way too hot and he wouldn't be able to cool himself down. He'd also had this excessive salivation in the mouth, which again is indicating a problem with the neural signals innervating the glands. And then he also had this dizziness and these balance problems, along with visual disturbances and chronic pain in different parts of his body. So before he'd come to me, he tried almost every diet. He'd got worse with a vegan diet. He'd done that for like 2 years. He tried the kind of GAPS, the keto, carnivore, really restrictive diets, and they actually made him worse. Now, he learned about thiamine deficiency. I think he learned, watched my videos. He looked at Hormones Matter, Chandler Mars, and Dr. Derek Lonsdale. And before he even came to see me, he'd been taking benfotiamine, which is a certain other type of thiamine that I don't generally tend to use. But he said that just at 1 capsule per day, he had noticed an immediate improvement in dizziness and balance. So he saw my videos, he got in contact, and what I told him to do is, while he was waiting for the TTFD to come in the post, I told him increase the benfotiamine from 1 cap per day to 4 caps per day. He was also taking a B complex, riboflavin, and magnesium as cofactors. So what he found was that as he increased the benfotiamine, it caused a temporary improvement in many of the symptoms, but then he did get worse. Now, this again is quite common. So as he was gradually shifting over to TTFD, what he found was within about 2 weeks, he's now able to eat many different foods. So meats, vegetables. He's also able to exercise, and this is the first time in a long time. His dizziness and vertigo are still much better than they were. The reflux that he was having, which was quite severe, has completely disappeared, and the bloating and burping showed about a 70% improvement already. Now, the upper GI motility, like he said that he felt like there was like a rock in his stomach, that has basically disappeared now, and he's having a bowel movement twice a day, whereas he was previously having severe constipation. Now, the libido, one of the things which neither of us expected to improve this quickly, the libido has returned. However, the fatigue, the LPR, and the salivation are still present, but again, it is very early days at this point. He's been doing this about 3 to 4 weeks, so actually, there's lots of good things to expect in the coming months. Finally, we have a female in her mid-60s. Now, this individual, she actually came to me and she'd done much of the therapy herself. So she'd actually tried lots of things before she'd come to me. She was familiar with the concept of thiamine deficiency. I think she'd watched my videos. She'd read Dr. Lonsdale's book on this. She'd already kind of educated herself on information around this. And she actually made most of the progress before she even came to see me. When she did come to see me, I said, right, okay, let's kind of work on the gallbladder, work on digestion and fat absorption and things like that. But I just want to talk about her case, talk about the benefits that she saw personally, simply because it demonstrates how one deficiency can really manifest in lots of different ways. So for this individual, the way that it manifested was that she'd get air hunger or breathlessness. So this was upon kind of very minor exertion. She'd feel that she could, the way that she described it was that her lungs were not able to absorb as much enough oxygen for all of her body, so she'd feel constantly kind of out of breath. Another thing that she displayed was a low blood pressure, which was unexplained, and high pulse rate. Now, she also had a history of central sleep apnea and quite severe dizziness. And so it's interesting to note that she had a history of metformin use. Now, metformin is known to deplete thiamine. So before coming to see me, she'd actually stopped the metformin and she prescribed herself a very high dose of benfotiamine at 900 milligrams per day, and she'd been taking 600 milligrams of sulbutamine per day as well. She'd also been taking a B complex and some minerals and been doing the carnivore diet. Now, what she found was that the fatigue had not improved greatly, but actually as she started taking the thiamine, that the air hunger and the breathlessness basically disappeared very quickly on, and the blood pressure and the high pulse rate came down to normal very early on, and the low blood pressure went up to normal as well. So this individual has found that when she does not take that dose of thiamine, those things come back. And again, she's been doing this a couple months. I think there's lots of other things that we need to be working on now. But ultimately, this is one of the ways that thiamine deficiency can manifest itself. And I really am confident that as she carries on, the central sleep apnea and the fatigue will gradually start to improve as well. See, sleep apnea is another one of those unknown symptoms of a chronic thiamine deficit relating to an oxygen deficiency in the brain. So if you're familiar with my videos, you've watched them before, you've seen the stuff I've done on thiamine, you know that this is my favorite book. So this book was done by Dr. Derek Lonsdale himself and Dr. Chandler Mars. She runs a website called Hormones Matter, which is full of information on thiamine. But essentially what this book goes through is all of the clinical pearls, all of the technical details on how a deficiency in this nutrient really affects multiple different systems in the body, how this looks clinically, and how you can address this in an effective way. So if you want to learn about this topic in a lot more depth, I really highly recommend this book because it is the best one out there. So in the next videos, I'm going to be looking at the clinical laboratory features of a thiamine deficiency. Are normal blood tests reliable? Can you rely on your doctor to identify this for you? Or are there other tests which you can look for? You look at kind of indirect markers which might indicate that someone is low on thiamine. And then after that, I'm going to be looking at different forms of thiamine and which one is best to take. So we're going to be kind of putting the different forms head to head, going through the benefits and the drawbacks of each different form and where they might come in handy to hopefully to improve someone's health condition. So thanks for watching, everyone. If you like this video or you found it helpful, please like and subscribe to my page. You can find me on EO Nutrition on Facebook. You can find my website at www.eonutrition.co.uk. I will be making more videos like this in the future. So thank you, and I'll see you next time.